Type 1 diabetes or type 1 diabetes is a serious disease that often occurs in adolescents. The symptoms of type 1 diabetes occur when the pancreas produces little or no insulin, which prevents the amount of sugar, glucose, in the blood from entering the cells to produce energy, thereby causing blood sugar to rise. Timely detection and treatment of the disease can help stabilize blood sugar, reducing the risk of dangerous complications. So how to recognize the disease early to have effective treatment? Please join Hello Baxi to learn 6 signs of type 1 diabetes in this article. 6 common symptoms of type 1 diabetes. The symptoms of type 1 diabetes are not always obvious. They can grow very quickly, appearing suddenly in adolescents and young adults, within hours or days. Meanwhile, in adults, type 1 diabetes symptoms often develop over a longer period of time, from weeks to months. Typical symptoms may include 1. Urinate more often than usual, especially at night. When you have type 1 diabetes, your blood sugar levels are high. At this point, the body will respond by forcing the kidneys to work harder to remove more sugar than usual through the urine, thereby increasing the patient's need to urinate. Children with high blood sugar need to urinate more often and produce more urine than the average person, especially at night. Your child may even wet the bed while sleeping, even though it has never happened before. 2. People with type 1 diabetes often feel thirsty. The symptom of type 1 diabetes is thirst. Because frequent urination causes severe dehydration, a person with type 1 diabetes will feel very thirsty and need to drink a lot of water to try to keep the amount of water in the body at a normal level. In addition, severe dehydration can also cause dry mouth and skin. 3. Feeling hungry often even after eating. Another symptom of type 1 diabetes is that people often feel hungry even after eating. The reason is that the body does not get enough energy from the foods it has just consumed. For people with type 1 diabetes, the pancreas produces little or no insulin, a hormone that plays an important role in converting carbohydrates from food into energy. Therefore, insulin deficiency can cause energy depletion. At this time, the need for food to get more energy of the body increases, making the patient often feel intense hunger. Hunger can persist even after eating. 4. Type 1 diabetes symptoms: weight loss and loss of muscle mass. Excess sugar in the blood passes out through the urine. At the same time, the body does not get enough calories needed through food, so it is forced to burn muscle and stored fat to create an energy source for cell life activities. Therefore, children or people with type 1 diabetes can experience sudden weight loss even if they eat more, and muscle mass will also be significantly reduced. In addition, prolonged dehydration also easily causes uncontrolled weight loss. 5. Irritability, fatigue. The inability of the body to use the amount of sugar, glucose, in the blood for energy, in addition to causing the above symptoms, can also make you feel uncomfortable and tired for a long time. This type 1 diabetes symptom will greatly affect the patient's study, work, and daily life. The symptom of type 1 diabetes is fatigue. 6. Blurry vision. With type 1 diabetes, patients may experience blurred vision for several days or weeks. This is because high glucose levels increase the osmotic pressure of the fluid in contact with the lens or cause swelling in the tissues of the eye, leading to blurred vision. This condition is temporary and will go away when blood sugar returns to normal. However, if your blood sugar stays high for a long time, the small blood vessels at the back of your eyes can become damaged and cause more serious problems, such as diabetic retinopathy, macular edema, or glaucoma. When do you need to see a doctor? Some of the symptoms of type 1 diabetes are similar to those of other health conditions and are easy to overlook. However, if type 1 diabetes is not detected and treated, it can lead to serious complications, even death. Therefore, you should see your doctor right away to have your blood sugar checked and have diagnostic tests done if you notice the symptoms of type 1 diabetes above or some of the more serious signs of the disease such as dry skin and mouth, red face, Breath smells like fruit. Nausea, vomiting. Breathe fast and deep. Stomachache. How to manage symptoms of type 1 diabetes effectively. How to manage symptoms of type 1 diabetes effectively. Currently, there is still no way to prevent and completely treat type 1 diabetes. However, we can completely control this disease by maintaining a healthy lifestyle, adopting a healthy diet. Science, reasonable blood sugar management, exercise, and regular health check UPS. If the child has type 1 diabetes, parents will need to make a healthy daily nutritional menu for the baby, as well as insulin injections as prescribed by the doctor. Also, get regular checkups, check regularly, and keep your blood sugar levels stable to prevent diabetes-related complications. Not only that, experts say that regular exercise can bring many health benefits for type 1 diabetes patients. Consult your doctor, dietitian for a treatment plan. Treatment and ways to help your child be healthier. Do not ignore the signs of type 1 diabetes. Early detection and timely treatment will help you prevent dangerous complications of the disease.